welcome to NED Talks. My name is Clare Grundel and I'm the managing editor of NED. And today I'm here with Jessica Rigutto, who's a fellow member of the NED editorial board and a registered nutritional therapy practitioner and a member of BANT. So Jessica is a senior scientist and lectures at the Institute of Food, Nutrition and Health at ETH Zürich, and therefore is a great person to listen to when it comes to picking apart nutrition studies. So Jessica, you recently reviewed this paper that we're looking at here, which was written on looking at maternal vitamin D and the risk of ADHD and was published in 2022. So welcome to the platform, and I'm looking forward to getting into this study with you.
Thanks so much, Claire. Thank you for the nice warm welcome. Great to be back here again doing another NED talk on this very important paper, actually. I really enjoyed reading it and learned a few things myself. So considering I have to teach on vitamin D on Friday, it was very good timing. So vitamin D, we know, is technically not a vitamin, as we can synthesize it in our skin, but nonetheless, it is very important, essential for our health. It has critical roles in the body. You know, we know about bone density very strongly, of course, cell growth and development, but that's where this paper then comes in. So the authors actually wanted to look at this aspect of cell growth and development, particularly the neurodevelopmental aspect that vitamin D has. It plays a critical role in utero, infancy, and in early childhood of developing the nervous system. So basically, the authors here were trying to look at the effect of vitamin D in pregnancy, so vitamin D status during pregnancy, and the effect on the prevalence of ADHD in offspring. But instead of looking at this directly in an RCT, they decided to take an RCT that was already ongoing in pregnant women and take data from that. So this is actually a secondary data analysis. The RCT was not designed particularly to answer this question, although I think it answers this question very well. So what the original paper was the original RCT was trying to do was look at prenatal vitamin D supplementation on the risk of childhood asthma in offspring. So it's another type of cell development, but asthma this time. So what the authors did was they looked at the pregnant women receiving and not receiving supplements, and then they followed their children until, at this point, age 6. But actually the study is ongoing still. And at age 6, they were able to look at the prevalence of ADHD in those children of the mothers who were either supplemented or not supplemented with vitamin D. So it's a very interesting way to look at the data from another RCT answering a different question for the question that we're actually very interested in. So there was almost 700 mother-child pairs, so a very large sample. The authors couldn't make a sample size calculation, understandably, because of course, as I said, this paper is a secondary analysis and is not reporting what the original RCT was planned to do. But considering the sample size is actually quite large, we wouldn't expect there to be an issue with power here. So they made maternal vitamin D classifications. Highly deficient was less than 12 nanograms per milliliter of serum, and sufficient went up to over 30 nanograms per milliliter. And ADHD was assessed through parental reporting of ADHD status between ages 6 and 9 years.
Okay.
So what they actually found was that baseline, so that's first trimester, there was actually no difference between vitamin D status in the pregnant women, regardless of whether they were receiving supplements or not, and then the prevalence of ADHD at age 6. However, this did become statistically significant at trimester 3. So maybe there is something happening here within pregnancy with regards to the need for vitamin C as the fetus is then developing. So with this neural development that would be happening. So they actually worked out there was a 53% less chance of having a child with ADHD at age 6 or later among mothers who were sufficient in vitamin D, compared to children of mothers who were not sufficient, who were deficient. And this trend was also linear. So very interesting findings.
Fascinating. Yeah, I mean that you can't argue with that statistic, can you? It's very significant, really.
Mm-hmm. Yes, yeah, I think it's a really important finding that they came across with this secondary analysis.
Yeah. Fascinating. Well, thank you for that. And then in terms of practitioners, Jessica, who are working in this area, what would be your clinical takeaways from the paper?
I think it's very important for practitioners who are working with women who are pregnant or who are looking to become pregnant. And of course, periconceptual nutrition is something that we're talking about increasingly these days, is to actually think about the vitamin D status. You know, we're always making sure that women are supplemented with folic acid, and their folate status is correct. But we're also here, we really need to start thinking about vitamin D, particularly in the UK, considering that it's only between April and September that actually we can make vitamin D from skin exposure. And vitamin D sources in the diet are few and far between. We have a little bit in dairy foods, some in liver, so organ meats, but other meats not really, and fatty fish, maybe eggs and fortified foods, but it's really not that wide. And particularly where we're thinking about vegetarians and vegans, it's very important to be testing the vitamin D status in these women.
Yeah, no, fascinating. And I know in my own clinical practice, I routinely test vitamin D. It is one of those tests that can be done easily through your GP, and if not, very affordably privately as well. So fascinating that this is also such an important demographic that need to be thinking about vitamin D testing.
Yeah, absolutely.
Thank you so much, Jessica. It's really interesting to get your insights on this paper. You can read all about Jessica and how to connect with her on the Nutrition Evidence Database by clicking on the editorial board tab, and you can access the full expert review. Let me just scroll down to it here on the Nutrition Evidence Database. So thank you so much for listening once again to this NED Talk, brought to you by the Nutrition Evidence editorial team in partnership with BANT.